Hi, my name is Dr. Charmaine Thomas. Welcome to our first ever podcast. And I have with me today Dr. Muir-Green. She is a hair loss specialist and a dermatologist. Doc, welcome to my podcast. I'm so happy that you're my first guest today. Oh my God, I am so thrilled. The reason being, because I know you,
Thank you
right?
for having me.
You are welcome. Doc, can you just tell me a little bit about yourself? Just, let the audience understand you, know you, feel safe with you. Yeah.
I am a dermatologist for better part of almost 20 years,
Okay.
and I got into hair loss because I really got into trying to understand hair when I was going back natural in my teenage years and trying to understand all of that aspect of hair care.
Hmm.
And during that process, I got really interested in everything about hair,
Okay.
everything processing of hair, whether natural, relax, or whatever. And I said, but I couldn't really become a hair care doctor. Let me become a hair loss doctor. And that's how that
Really?
journey started.
So do we have a lot of hair loss specialists here in Jamaica? I'm not.
No, I mean, all dermatologists have done some amount of training in hair loss,
Okay.
but I'm the only one specifically did further training in this area
Okay.
in the Caribbean for the most part.
In the Caribbean.
Yes. And
Oh my goodness. Wow.
I've, but you have hair loss specialists for the hairdressers and
Okay.
stylists. They do have their own thing called the trichologist,
Okay.
and you do have other persons who have more interest in hair loss. But I went and did further training specifically for it.
Got you.
Hmm.
Well, Doc, the hair loss thing well, for me, I can tell you, I love to tell my story because I actually went through hair loss.
Hmm.
My
Hmm.
menopause
Hmm.
journey started, and the hair loss started with my journey.
Hmm.
And talking about menopause, as you know, we're here, we're doing this, we're talking about women who, from age 35 all the way up to 55 and above, just all the way through. Menopause is a serious thing, right? And today, I want to talk to you about midlife skin and scalp drama no one prepared us for. No one prepared me for hair loss.
Yeah, yeah,
No one
yeah.
prepared me for all the stuff that I went through.
Hmm.
I don't know if you remember when I came to you.
Hmm. I remember.
I was losing my hair, my edges, everything like that. By the way, guys, I have a wig on. Yes, I do. Right? So tell me, I want you to share with the audience exactly what you did for me because my hair is growing back. I'm getting back my edges and everything. So tell the audience exactly what you did for me.
So essentially, whenever a person comes in, I want to get their full story. A
Hmm.
lot of persons just want to focus on it here, but I need to know exactly what is happening with them, what
Okay.
medication they are on, what medical issues they may be having,
Hmm.
and I would love to see whatever blood tests you've done recently.
Okay.
And of course, I also want to know what you're actually doing with your hair. You
Okay.
could be doing all sorts of stuff with your hair and not realizing that is what is causing your hair loss.
Such as?
Such as, and I've had this happen where I had about three women come to see me for hair loss, and they were dyeing their gray hairs because, a lot of people don't like their gray hairs.
Dyeing gray hair is good, doc. But
And
wait, what
then,
kind of thing is that?
and then
Yeah.
because they're dyeing their hair,
Okay.
they forgot that they need to take care of the hair. And when you dye your hair becomes extra dry
Okay.
and will break off. And so they weren't deep conditioning their hair. They weren't putting in leave-in conditioner daily, and so their hair was breaking, and
Mm-hmm.
that was the main cause of their issue.
Okay.
So I need to know the full story so that I can actually tailor my treatment for you.
Okay. You really did tailor my treatment. I have to say,
Hmm.
you followed through all the way. But can I ask you, can stress, because I do think that I was stressed during my time when I was going through my journey
Hmm.
with menopause. I'm still going through my journey, but I'm less stressed now because
Hmm.
I've become a specialist. Ah. All right. So, can stress cause your hair to fall out?
Well, stress worsens everything.
Mm-hmm.
Stress makes your skin go bad, your hair fall out,
Mm-hmm.
all of the things just go terrible with stress because our skin is actually tied to our mental health.
Okay.
And from birth, when you're being from, in the womb being developed, the
Mm-hmm.
skin and the brain go together in terms of the development. And
Okay.
so that stays with you for life. And so every time you go through some sort of mental stress,
Mm-hmm.
something is going to happen, whether your hair is going to fall out, you're going to break out in acne, or your eczema flares up or something like that.
Okay, wow, that is that is serious. So how can we try to, I mean, I think that is for all us doctors to kind
Hmm.
of know. How can we try to assist a person in alleviating their stress? I mean, you when I came to you, you had a frank conversation with me.
Hmm.
You talked to me about, everything in terms of why I was losing my hair. You spoke about my stress, and I think I was able to talk through it with you because I felt comfortable with you
Hmm.
and I was able to talk it through with you. And I think it's because of that my stress factor tend to relieve itself.
Hmm.
And then now I went ahead with treatments that you suggested. I love that. So tell me how can we?
So I think, for me, I think it's best to address the whole holistic aspect of the care
That's
for the
the key
patient.
word. Yes.
And during menopause, I mean, a lot of people, not only are you going through this actual physical change, but a lot of persons are actually going through other changes. They're becoming empty nesters.
Mm-hmm.
The family dynamics has changed. You realize after 20 odd years you're with this person, you realize, I don't think I really like this person that I'm living with.
Right.
You've actually, diverged in completely different directions. And that also adds to the stress of the whole menopause
Doc, I
situation.
think you have stepped into something really, really serious, man. In terms of the family dynamics,
Yes, yes, yes.
some men don't like their wives, some wives don't like their husbands, and hence stress.
Stress and everything just worsens everything.
Right.
And it's learning to say, okay, what can I actually encourage persons, and I've always said to people over the years, always try to go and do counseling of some kind.
Mm-hmm.
It's always useful. You don't have to be counseling forever,
Right.
but it's helpful to, try to piece together what is causing the issues at that point in time
I
and see
agree.
how that can, be stemmed.
This episode is sponsored by Wicks by Grace. They're made in Jamaica. They're all natural scented wax candle. It smells so good, guys. The episode today, the scent of our episode is called Clarity. As you can see, it's made from peppermint and eucalyptus. Welcome. So, my next question: why are women getting acne? Because I know you delve into that very well. You're a dermatologist. So, why are women getting acne at 45? I've had women that come into me 45 and even up to 50 and they have acne.
Hmm.
Why is that happening?
So, the unfortunate thing with women is that you can have acne at any age.
Really?
And
Okay.
so at puberty, testosterone along with estrogen goes high for everybody, both men and women.
Mm-hmm.
And so testosterone is the what causes acne. So that is what is supposed to happen in the teenagers.
Mm-hmm.
By the time you're in your 20s, those hormones kind of dwindle back down, and your acne is supposed to get better. No, it can persist in women with adult female acne in their 30s and 40s
Mm-hmm.
because of hormonal issues. And a lot of women have hormonal issues like polycystic ovaries and some other stuff like that.
Do you think polycystic ovaries, how can I say this? I want to say it in a way in which
Hmm.
I don't necessarily offend a
Hmm.
lot of people
Hmm.
because a lot of females come to me and they say to me, Doc, I have polycystic ovaries.
Hmm.
How do they know? I mean, a lot of the times they're not even, they don't go anywhere to find this out. They just have irregular periods. Maybe they have acne, some hirsutism, which is, a whole lot of hairs on the chin.
Hmm.
And then they assume it's polycystic ovaries. So how do we?
So a lot of people do a lot of assumptions,
Mhm.
unfortunately, and or a doctor would just tell them, "Oh, you have hormonal imbalance," and they just go home with that hormonal imbalance in their mind
Mhm.
with no further testing,
Right.
not understanding that if they're tested, whatever they come back with as a problem can be corrected and treated.
Right.
And So when a lady comes in and never had acne ever in their life and 40 years old, all of a sudden getting acne, very terrifying because you're like, I've had smooth skin my entire life and here I am at 40. What is going on? I then do hormonal testing on them.
Good. So
I
that
don't
would even let us know if she
what
truly has PCOS or not.
or exactly
Right.
or
Good.
some other problem. And I've
Right.
had persons actually come back with weird and wonderful issues that needed to go and see the endocrinologist for, which is a hormones doctor, or
Yeah.
the ENT specialist and other specialists
Right.
for treatment. Yeah.
Okay. So I just want to say to the audience out there, um, I know that this conversation may be intense, maybe for just the regular persons who may not understand every single thing because we're maybe talking in medical jargons, but it's quite simple. Hair loss in menopause. And it happens because I had hair loss and now I'm regaining my hair because of this wonderful doctor here. So this is our conversation line. This is what we're talking about. Doc, let's get back on track. So we're talking about stress and we also talked about, possibly PCOS. We talked about acne. What else you feel you want to contribute or say in regards to what happens during our menopausal years?
So I think also other hormonal issues.
Right.
Yes, the estrogen starts to diminish a bit,
Right.
and that is what makes you, a woman. So and basically, you have a relative rise. It's not like it's a massive shift in the testosterone,
Right.
but it's just a relative rise, and therefore a lot more women come in with the hair on the chin, around the nipple, the belly, and they're like, "Oh my goodness, where all this hair come from?"
Yes.
And or they start to see the thinning in the hair, um, or they start to have the acne at that point in time, and can be a little bit frightening because this is not who you know yourself to be,
Right. Right. I
and
agree. I agree.
and you're like, what do I do? How do I address this? And some people just think, oh, it's just old age, and I've had that happen.
Yes.
I've
Yes.
actually had that happen,
Me too. Me too. Yeah.
where a lady came in and she was like, she had hair all over her body. Oh, it's old age, man, you're a grandmother. And I'm like, no. I'm like, which grandmother look like this? No, ma'am, no, no, no. You have something else happening.
Right.
And she actually
Exactly.
did have something else.
Okay. See.
So you have to, if it's not feeling like you, seek help. And if it's not making any sense, seek a second opinion.
Doc, this is why you're the expert. I'm telling you, persons coming to me, they come with a lot of gray hairs. So, I also specialize in aesthetics and they come with hair, yes. And I'm going to talk about the vaginal hair mostly because they come with that and they want to get rid of it. And a lot of it is gray. So, and then they ask me, can I get rid of it using the laser? So the answer to that, and I want you to tell people because they are thinking that it is possible. So you can go ahead and explain for me.
No, it's not. For the laser to work, the laser light has to have a difference between the skin and the hair, and the target thing that it's targeting is actually the melanin, which is the color. So if the color not there, there's nothing to
To
target,
target.
unless somebody comes up with a gray hair laser.
I wish they would.
But at this moment
Why
in
don't we
time,
create something like that?
could probably try something, yes.
Yes.
But at this moment in time, the only thing they could probably do is just waxing, sugaring, or
Sugaring is painful.
I would
Sugaring.
I sugar it all the time.
Doc, your pain tolerance high, man. No, sir. What? No, I tried it. I went like quarter way ish. I was like, no more. I'm not doing that. Okay. Waxing, I barely tolerate it. You have to numb me first for maybe an hour, and then you can go ahead and wax me. But my God, sugaring. Okay, continue. I don't know what's up with you, Doc.
So waxing or sugaring or You can also do electrolysis.
Okay.
That's
Yeah,
the
yeah.
only other way that they could probably, because that directly destroys the hair follicle itself.
Okay.
And that's the only thing that will get rid of it.
So electrolysis also destroys the gray hair.
Yeah.
Okay.
Yeah, that's the only
So
way they
that's
could.
a wonderful thing. Is it,
Hmm.
do you know if it's offered here in Jamaica? I've never
We
heard.
do have places that offer it, and I think
Okay.
about 2 or 3 places in Mobile, I think, offer, I believe.
Okay.
Yeah.
Oh,
Yeah.
interesting.
Mm-hmm.
All right. Well, I want to get into the next section. I want to talk to you about myths,
Mm-hmm.
the myths, the medicine, and the misinformation. So, guys, excuse me because I am 51 years old and I literally have to read my screen like this. My phone, I feel like it's too small for me now. I don't know what you think. But anyway, let's talk about myths. What's one dermatological myth about menopause you wish you could erase forever?
That's a good one. Um, that the menopause is still happening at age 70.
Ah, yes.
I've had persons come in, I went into menopause 10 years ago, but I'm still having these symptoms. And I'm like, no, if you're still having these symptoms, something is
It's wrong.
wrong.
Yeah.
I mean, a lady is sweating. She can barely sit down without sweating.
Mm-hmm.
And she's 70 odd. And I'm like, ma'am, something else
Else is,
has to be happening.
yes.
Because you would have, everybody else around you, you and your counterparts already went through menopause together.
Yes.
And they're not dying like you are. So something else is happening. So if something seems to be still out of place way after menopause
Mm-hmm.
had occurred,
Mm-hmm.
then you really have to wonder if something else is happening and you need
Agreed.
to investigate it.
Okay.
Hmm.
I like that. Right. Another myth. Can you actually reverse the damage, or is it about learning how to manage it well? And we're talking about everything dermatological in terms of menopause. Can any of it be reversed?
That's a very good.
Say yes. You know why? My hair loss. We gotta approach that because I have to tell you, I am growing back hair.
So you can grow back your hair,
Mm-hmm.
but if it depends on the type of hair loss that you're having.
Okay, got you.
So some persons that actually have complicated hair loss where the hair naturally, depending on the type of hair loss they're having, um, it actually causes permanent hair damage, and so the hair won't grow back.
Mm-hmm.
And when you undergo menopause, the whole symptoms of menopause
Mm-hmm.
aggravate that underlying what we call scarring alopecia.
Right.
And so if they
I-
don't come in,
Is the scarring alopecia a reversible damage or
no,
no?
it's
Right.
for the most part no. It once you get treatment from early, it is
Gotcha.
reversible. But the
Okay.
longer you wait, it's irreversible.
Oh, wow.
So that's
Okay.
the main issues. I've had persons who the entire center of the scalp is completely
Center?
bald, and
Wow.
they've just been hiding it all this time. And then when it got to menopause, it got even worse
Mm-hmm.
because other types of hair loss is kicking in, which is the age-related hair loss.
Understand. Yes.
And then and then they want you to completely reverse everything, and it's unfortunately not possible.
Not possible.
Yeah.
All right. Thanks, Doc. So let's get into another segment,
Hmm.
which would be confidence and rebuilding.
Right.
This is so important, so much information here. What do you say to women covering her hairline with edge control
Hmm.
and anything, any kind of product that
Hmm.
she's trying to cover her hairline with? What do you say to those women?
Well, it depends on what you want. I mean, some want to cover their grays, so they will use some of those kits that do temporary covering, or they can use henna to help with that.
Henna.
Yeah, to help with the color. And
Okay.
persons have, the thinning of the hair, the edge control. Yes, it can make it look stylized and what have you, but in order to get back the edges or the hairline to come back, you
Mm-hmm.
have to figure out what is triggering that for the hair to come out.
So
And like I
weird.
said,
Okay.
some persons, their vitamin D levels are low,
Okay.
and once that is corrected, the hair will start growing back
So,
in.
people wouldn't even realize that the vitamin D level is low, and that's what's happening,
Yeah,
why they're
yeah,
getting so many conditions.
definitely.
Even tiredness.
Yes.
They don't even realize that tiredness alone,
Mm-hmm.
once a person comes in to say they're extremely tired,
Mm-hmm.
we have to pay attention to doing their vitamin D levels to see if it's
Right,
low.
right,
Right?
right.
So you're saying now that that affects the hair as well?
Yes.
Wow.
So
Okay.
vitamin D levels, zinc levels,
Mm-hmm.
your thyroid, and a lot of women go hypothyroid or under functioning thyroid,
Right.
and the hair will thin out. Or if they get overactive thyroid and the hair will thin out.
Mm-hmm.
And so if that is not corrected, the hair will, the age-related thinning that you would get is not, will actually worsen.
Understand.
Hmm.
All right. So the next question: what are some signs? You don't have to tell me three. You can be one or two. That it's time to see a specialist, and not just to switch shampoo.
See a specialist when you are combing out and you see a lot of hair.
Mm-hmm.
If you have straight hair, you see hair all over the place, or if you have curly to kinky hair, the ball of hair is like a whole lot. So if the normal ball was this small and then it's now this big, then you
Okay.
know something is going on and you need to seek help for that.
Understand.
Or if you're having a lot of tenderness, itching, burning, crawling sensation, flaking, bumps in the scalp, go and seek help for that.
Oh, there are people that come in with a lot of flakes and they think it's probably dandruff,
Right,
and that's it.
right,
But it's very flaky. There has to be a lot more happening.
right,
Can you
right.
just tell me one of the diagnosis? Um, I mean, you're the expert. One of the diagnoses that when a person comes with a lot of flaking, what would you first think to yourself?
Well, the first thing I think of is seborrheic eczema, which is dandruff.
Okay.
However, there are other things that people can get, such as psoriasis, and we do have scalp psoriasis in
Scalp psoriasis.
in
Okay.
Jamaica.
Wow.
We do have it. We also have patients who have very rare scarring alopecias like central centrifugal cicatricial alopecia, where they
Dog,
get
you're talking jargons now. I'm like, what?
is the center of the scalp,
Mm.
and it's called CCCA online. So a lot of people know by that acronym
Okay.
CCCA, and
Okay.
it's in the center of the scalp, and they get a lot of scaling in that area,
Right.
and so um, you may be having something more than you actually think.
Mm-hmm.
Hmm.
Okay. All right.
Or, and this has happened
Mhm.
because it started to dye their hair and they're allergic to the dye.
Yes, I agree. I agree with that. But Doc, I also kind of believe in dyes. I'm sorry. We can't walk.
I'm not saying no.
We can't walk around with gray hair.
No, most people dye their
Like
hair.
I'm
Most people
too
dye their
too
hair.
cute for that. But I understand what you're saying. I do dye my hair. I like to dye it black.
Mm-hmm.
And we've had this discussion before. Um, so I get what you're saying. Too much of the dye can cause an issue. So for a person's hair. So
Well, it depends because there's some people that nothing happens to them,
nothing at
but it
all.
all
Okay.
depends. You can develop an allergy to it. So if
Okay.
something starts to change, like a lot of burning sensation when you use
Mm-hmm.
it, or you start to see a lot of flaking,
Mm-hmm.
then it means that you're probably developing an allergy to it.
Gotcha.
Hmm.
Right. So our viral moment prompt. All right. I want you to finish this sentence for me. Menopause changed my hair, but it didn't change my.
Personality.
Oh, I love that. I love that. Yeah. No, you're right about that because it didn't change my personality at all. But to be honest, though, I have to be frank. I did go through a little bit of depression,
Mm,
right? Not depression for medication,
mm-hmm,
but depression just understanding what is happening to me and trying to filter and find someone that can actually help me
mm-hmm.
to make it through this. Because remember, it's a new era.
That is true.
You know,
And nobody prepares you, as you said,
nobody,
because our
nobody.
parents spoke about puberty. They tell you,
Mm-hmm.
oh, you're gonna get breasts, you're gonna get
Mm-hmm.
period,
Right.
all of these things, and how your mood gonna change when you turn a teenager, and all of these things.
Mm-hmm.
Nobody talks to you about retirement.
Right.
Nobody talks to you about menopause. Nobody talks to you about anything about that aspect of
It's
life.
true.
Midlife crisis, what is that?
What is that? It's true. So our parents gave us an intro, but they never gave us an outro.
No, they did not.
No, they did not. And speaking about outro, if no one else has said it to you today, you're not vain. Okay? Please understand this. You're not vain. You're not imagining it. And you're definitely not alone. Your hair matters, your skin matters, but most of all, you matter. Dr. Muir-Green, thank you so much for joining us. I don't know if you want to give any words of wisdom or encouragement to our audience that's watching today.
Well, just want to say that this journey is new to you, but others have gone through it, and you've actually seen them at the other side of the journey. And so take hold or take heed of the fact that others have gone through it, you can also go through it, and always seek help, because when you feel overwhelmed, it's better to actually seek help and get the help that you need
Love
rather
it.
than sit down and just wallow in self-pity. And and even if you're feeling down today, you're not down all the time. Always think we're gonna get there. We're
That's
gonna
right.
get there. And you are still who you are at the end of it, despite all the changes that you are experiencing, you are still yourself.
Wonderful. Love it. Once again, guys, love yourself. See you next time.